next local, and this one is super interesting. I'm here with Dr. Abby Egginton of Balanced Natural Medicine.
Yes.
So I know no one knows this about me, but I love this kind of thing. So tell us what it is you do.
So I'm a naturopathic doctor, also trained as a registered nurse, and I've been practicing naturopathic medicine for over 10 years now. So a lot of people aren't familiar with naturopathic medicine, but we're trained like primary care providers, went to 4 years of naturopathic medical school. I went to school out in Seattle. I grew up in New York, but I just recently moved to Massachusetts because NDs are now licensed in the Commonwealth, which is awesome, very exciting. The bill for licensure passed about 6 years ago, but because of the pandemic and everything, they only started handing out, they had to write the bylaws, so they only got the licenses handing out last year. So I moved here.
There's licensing in other states, or is this like the first one?
Yeah, all right. Sorry, I should clarify that. But yeah, we're licensed in about half the states in the country.
All right, that makes sense.
It's a kind of an interesting history that goes back to the early 1900s with the formation of the AMA. It kind of squashed out a lot of alternative medicine, and naturopathic medicine being among those professions. So, so now, there's definitely kind of a shift, right? People are looking for more complementary options, more of a functional medicine approach. I always say naturopathic doctors are like the original functional medicine doctors, right? They're really looking at a person super holistically, considering all aspects of their health, mind, body, and then, making recommendations in terms of diet, lifestyle, supplements. But also, we're uniquely trained in that we're also trained in pharmacology. So we are really cautious and cognizant of possible drug-herb interactions and, what diets are appropriate for what patients and all that kind of thing.
So we had talked over at Discovery Day about like homeopathy. So, those little white pills, right?
Yeah.
Like you prescribe that as well, correct?
Yeah, so homeopathy is really interesting because technically its own form of medicine. I always say it's a little like acupuncture. It's an energetic form of medicine. And so it's a discrete form of medicine. All naturopathic doctors are trained in homeopathy.
Okay.
But you don't have to you don't have to be a naturopathic doctor to do homeopathy, right? There's homeopaths,
right.
They can be MDs, they cannot have a medical licensure, and so I have trained pretty extensively in homeopathy. So I do try to use it with a lot of my patients because it's a very gentle and can be very effective form of medicine. It's challenging to do homeopathy well, but when you find the right remedy, it can be really
mind-blowing.
Yeah.
I have experience of that.
Awesome.
So if someone comes to you, like what's in your bag of tricks, right?
Yeah, well, that's what I always say I love about naturopathic medicine is that we have a lot of tools in our toolbox. And really that's, what I love about it is that I'm talking through those options with patients. They don't necessarily have to, they may consider all those options and decide, okay, none of these are for me, but at least they know there's other options, because when you go to your primary care doctor or even some specialists, they don't necessarily have the time to talk through all of the options. They're going to probably present you with one or two options, but they don't necessarily have the time to kind of talk through all the options or what you could be doing outside of, pharmaceutical or surgical options. So, the diet and lifestyle piece. So it's really, what I've trained, or, as I said, what naturopathic doctors get trained in is a lot of dietary recommendations. We get extensive training in counseling. So we use a lot of motivational interviewing, but also CBT, obviously botanical medicine, homeopathy, and we also do get trained in hands-on modalities like chiropractic techniques, massage techniques, craniosacral therapy.
So everything.
Yeah.
So you can do everything.
It's kind of like going to a nutritionist and a chiropractor and an herbalist and a homeopath all wrapped into one.
So do I come to you if I'm sick, or do I come to you to stay healthy?
Yeah, that's a great question. obviously, well, so who I typically tend to see, I see a lot of people struggling with GI issues, gastrointestinal issues. I see a lot of people with anxiety and depression who maybe are looking for options outside of pharmaceuticals. I see a lot of kids with eczema or allergies. And I do a lot of women's health, so thinking about hormone issues and all the forms that those come in. And then I did a residency in oncology, and so I work with cancer patients while they're going through conventional treatment, helping with side effects. And then once they're done with treatment, trying to reduce their risk of recurrence through diet and lifestyle and supplement recommendations. But I also love when people come to me more preventatively. That's kind of, I just really rejoice when that happens, because I'm a cancer survivor myself. So I think that's a lot of my interest in naturopathic medicine is like, if you have a family history of cancer or you have a personal history, you're feeling well, but like, what can you do to, decrease your risk of recurrence or, decrease your risk based on family risk and genetic risk factors. So that can be really powerful. So I love when people kind of take that preventative approach, even though, it's not as common.
And not to get practical, but like, does insurance cover this or?
Yeah, so unfortunately not, although if you have a flex spending or health savings account, that can be used. I mean, because we're newly licensed in Massachusetts, I'm actually the president of the Massachusetts Association of Naturopathic Physicians. So we are working on getting insurance inclusion, and from our conversations with insurance companies, there's an interest to include naturopaths. Which makes sense because we are, decreasing risk of chronic disease. So I do think it will,
it'll happen.
Yeah, just a matter of time.
Always time. So what made you get into this? Like, did you always want to be?
So I was pre-med in college. I was a college athlete. And then I also was diagnosed with cancer when I was in college. So. But it wasn't really, I don't think it was honestly really that kind of, but I, from being an athlete, I was aware of how, my diet and lifestyle were so integral to how I functioned. And then, I experienced that through my illness. But really what got me into it, I went to Mount Holyoke, and we had like J-term where you could take whatever class you wanted. So I took a food and Chinese medicine class, and really was just fascinated about how closely in Chinese culture, food is tied to health, right? Less so than it is here, really. So I did an independent study, diving into Chinese medicine. And while that's super fascinating and I love it, I didn't feel like it necessarily applied to our modern day lives. So when I discovered naturopathic medicine, I was like, oh, this is a great fit. It's very evidence-based, right? We use, ancient modalities like homeopathy and herbs, and certain nutrition interventions and hydrotherapy and that kind of thing. But, we definitely are aware of and incorporate the evidence-based medicine piece. So, it's really a complementary, integrative approach. And I think that's helpful for people this day and age.
Yeah, definitely. Well, thank you so much for your time. This was so interesting. I really appreciate it.
Thanks for stopping by.
Yeah, thank you.